causes chest pain. It can be an MI. It could be, problems with your gallbladder. It could be many different things. Okay, so chest pain is chest pain. It could be the MI. So you need to ask that. One of the main things about the aspirin is that it needs to be in the patient as soon as possible. If not, in the future, you guys will learn other medications. But the main thing is we don't want that clot to keep on forming. That's the most important thing. The bigger the clot, the more obstruction is gonna occur in that vessel. So remember that. So you already got the chest pain. Now the other one is, what's your name again? I didn't even know it was you because you didn't have that red jacket on. Lewis. All right, so for hypoglycemia, what are you gonna give? No, that's the chicken. Oral what?
Oral glucose.
Oral glucose. So that's your other scenario you can have, hypoglycemia. So there you're gonna give oral glucose. Okay, the way you give it, and remember the videos that we saw? Shitty box. Okay. Aspirin nitro for chest pain, right? Nope. MDA. Aspirin nitro. Okay, this one is a spray. Okay, this one's spray. They also come in these little tiny pills.
That's the NDA? No.
This is the MDA. And that could confuse you. Put it away. All right. So this one, it's a spray. This one, guys, when you are practicing here, this really has nitro. So be careful because the side effects of this is you're gonna get an extreme headache. Okay, and another one is it's gonna get you hypotensive. Okay, why Laura? Why does it get you hypotensive?
Because it's treating your hypothermia and it's treating
No.
chest pain, so your heart beats.
Dilate here.
The vessels. It's a basal dilator. So it's gonna drop your BP. And it'll stay in your system for a while. So you can have that drop in BP. Okay? And you're gonna have that extreme headache. And these you always need to be primed. Okay?
What is the name of it?
Because many times, they have air in there, so they need to be primed. If you need to prime it, you should prime it always first before you introduce it to the patient, okay? This goes sublingual, under the tongue. Tell the patient, lift up your tongue or touch the roof of your mouth, and then spray, one spray only, okay? Only one spray. Now, if it's the pill, you get that one pill, put it under the tongue, same thing, okay? But if you're gonna prime it, which you should before you spray it, you need to do it like if you're in your truck, outside the truck, or outside the room that you're in. Because you prime it in the truck or in the room you're in, it's just gonna go in the air and then you're gonna inhale it and then you're gonna have the same effects that, you guys smell it? Does that smell it?
Yeah, it smells like cherry.
Hey, why don't you try it?
No, I'm good.
Okay, and there's a possibility that you can have the same effects. Okay, you don't want that, especially you. And say your BP is normally 110 over 74, this can lower it all the way to 88 over 60. Okay, very quickly. So you don't want that, then you're gonna be, it's gonna go away, but then you're probably gonna need an IV to be put in, give you fluids to try to raise that bottom. Okay, so once again, chest pain, right? Here's the aspirin. Right, chest pain. Aspirin and nitro. All right, oral glucose, okay? The whole bottle, complete thing needs to be given to the patient, okay? You're gonna squeeze it in between the cheek and the gum, or like this, huh?
Both sides, right?
Yes, from one side to the other. It will get absorbed by the mucous membranes. They're probably gonna swallow a little bit, that's fine, it's no big deal. But you wanna start off always in between the cheek and the gum, and you gotta give the whole entire thing, all right?
That's crazy.
This, huh?
That's insane.
The whole thing. This will probably take about 5 minutes, 6 minutes for the patient to actually start coming around, acting normal. Remember, contraindications, they need to be able to be responsive, okay, and be able to swallow, okay? If not, then you don't give it. Like, for example, same thing for the nitro. Okay, contraindication for this is, once again, they're allergic to it, right? For the aspirin. Now, for the nitro, contraindication is if they're hypotensive. Okay, you're not gonna give it to somebody, your guys' protocols right now is 98, 100,
Unresponsive.
right? Below 100. If it's below 100, you're not gonna give it. Okay, and like my protocols say 90. Now, through experience, I've had patients who have a BP of 104/70, let's say, and my protocols say 90. If I have a patient like that, that's borderline hypotensive, me personally, I don't give it unless I have a line established on the patient. Because if the BP starts going down, I just open up the line, give them more fluids to create that volume that is being lost because of the vasodilation. But I mean, I've given this to a patient who was 104/70, who I didn't have a line on, and all of a sudden the patient's gone unresponsive, and they will, because their BP will drop so quickly that they won't be able to recover that quick. That's why it's so important. You need to ask, are you taking sexual enhancement drugs in the last 24 to 72 hours? Because that already is a vasodilator. Now you're giving them this, and now you're dilating even more, and they'll be so dilated to the point that you're not gonna be able to bring them back. That's how bad it is. Doesn't matter what you
What
give.
does that do to the patient in terms of,
It just opens up everything, and then
I know, but like in terms of like you're looking at, what,
the patient will just go into a syncope episode.
I remember the first time you taught us about aspirin, you said it's not the same thing as nitro, but what does it do?
It prevents the clot. In better words, what it does, it prevents the platelets from sticking together.
Anticoagulant.
It's not an anticoagulant.
No.
It's an antiplatelet. It doesn't let the platelets stick together. Okay, which that's what forms the actual clot. Okay, once the platelets start sticking together, then fibrinogen starts kind of being produced, and that's what starts creating the thrombus, right? Because that's what a clot is, the thrombus, right? So this is what did you say it was? MDI, meter dose inhaler. You need to shake it, okay? Remember, every medication you're giving your patient right now, remember, you guys don't have any license for anything, so you are assisting the patient. So you're gonna imitate, like, here, sir, let me assist you, okay, whatever. Okay, by law, we need to teach you that. You guys are assisting. So you shake it, and then when you tell them to inhale real deep, and then that's when you assist them, and you squeeze it, and you're gonna do it twice. Okay? Not one after the other, just, No, this one you don't prime. If you see that it's not coming out, then maybe you might have to prime it, all right? MDI, meter dose inhaler, for shortness of breath. So you have chest pain, hypoglycemia, and then you have shortness of breath. Now, this is a EpiPen. Your other scenarios could be anaphylaxis, okay? Patient goes into an anaphylactic shock. So, again, this one is a trainer, so it's no big deal. So you pop the bottom, it's caps. So you pop the cap, okay? Pop the other cap, and then you stab the patient and hold it for how long?
10 seconds.
10 seconds, okay? And you need to do that. So all the medication goes in there.
Well, you're not doing it, you're assisting.
Exactly. What is this called? This route? IM, right? Intramuscular. So once it's in, count to 10 seconds, the patient should get his or her medication. Okay. No, just because for me, like, if I'm here, I'd rather do it there. Because I'm here, you understand? So here it's easier for me. Okay, so if you're gonna do that, usually it's gonna be better. On the opposite side, you're gonna have better control, right? Remember, you need to always be the one in control. A lot of patients will try to be the ones to be in control. Okay, you need to be in control, especially in the future when you start doing IVs. A lot of people, just hold the patients really soft. You need to really hold the patient, really grab them, grab their joints. Okay. So remember, bottom first, then top. All right. So that's your other scenario. Now the other scenario is if the patient, we were talking about 4 scenarios, right? Now the other patient is if he is hypotensive. So said, what are we going to do for a patient who's hypotensive?
We are going to, something like that.
She starts getting red.
Oh,
Hypotensive.
So he's on low.
Okay, I'll tell you the first letter,
Regards to-
T. R.
Tachycardia.
Here's Suzette, you need that? T, R,
Tachycardia.
no, what you need to do, are you confusing me?
It's triggering her, bro. It's triggering her.
Write it down.
Tachya.
T, R, E, N.
Whoa, what?
Hello.
Okay, sorry.
Can you let her figure it out?
I was spelling something else.
Trendelenburg.
Oh, I hate that word, yeah.
Okay, so you're gonna put the patient supine. So let's say you have your airway bag or your trauma box.
not, this need is yours.
Put the patient,
Lift him in, so.
right? Lift the patient's legs, put it under them, and that's it. That's all you gotta do.
Trying to demonstrate.
We gonna have that?
This is gonna be there with you. Okay, this is part of your equipment. Okay, this is your airway. Remember, you gotta give an airway treatment, right? When do we give the treatment for airway?
If they have a closed airway.
What did I say, Bianca, about O2 in patients?
Oh, I thought you meant like an OP.
Sir.
Every patient gets oxygen.
Everyone gets O2. Okay, so when will we give the O2?
In the beginning.
Huh? No.
Now, when he's low on O2,
No, every patient gets O2.
When you're assessing what's happening to him, after you do the history of the patient.
When you're checking the airway.
chat.
Not just checking,
The saturation level?
every patient gets O2. So even if they're sitting on
So that's it, then you
100%,
just-
they're still gonna get
So
O2.
after you check the airways, you just put
Not the airway,
the.
Oscillating the
the
lungs.
breathing. After you finish, the B's, right?
Oh,
B's are rate, rhythm, and quality, lung sounds, O2 sat, and what?
That's when you establish,
Accessory muscles.
that's when you establish
After
how
you,
many
yeah,
O2.
after you do your B's, then you put them on O2. It could be a nasal canna, non-rebreather mask, or you might have to use a BVM. Right, I'm not gonna talk about too much, O2 or airway adjuncts right now, because on, Tuesday, we're gonna do a little more of that. Okay, remember guys, Tuesday is the last day you guys have to have real hands-on. We're probably gonna be in here in class for maybe 15 minutes, then you guys are gonna go to your, labs that you're supposed to go to. And that's it, that's really your last day to have hands-on. The following Tuesday is your airway adjunct test, okay? And you will give you a review, like the whole class, like while they're testing, while a group of 3 or 4 are testing, we'll be in here giving a review. And that'll probably be the last time you have to ask questions or to get comfortable with whatever it is. Okay, so that's what I wanna talk to you guys about, the 5 scenarios that could happen. Okay, we're not gonna make it difficult, we're not gonna say the patient, had a motorcycle accident, but he was still walking, and then at the same time, he was, having shortness of breath, but he's telling you he's dizzy, and he went, to Red Lobster and ate shrimp, we're not gonna do that. So he's like, okay, which one is it? It's gonna be straightforward, okay? Alright, so, real quick, so, remember, I told you guys you have what? How long to write in a blank piece of paper?
60
60 seconds.
Seconds, right? So are you gonna write the whole entire thing?
No.
No, okay? So let's just write the main thing. You guys already know BSI's insecure, you know that, right? You have to write it down, remember you have 60 seconds. Those BSI's insecure, writing it down can, make you waste your time. But if you wanna write it, write it. So you have, BSI, right? It's insecure. Right, now what's the first thing that we're gonna write first?
History of the patient.
HOI,
History of the
right?
incident. For the incident.
HOI. And you write it there because here is where you're gonna write the information that they're gonna give you, right? So what's the next step?
General appearance.
GAP, right? And you don't have to write general appearance of the patient, abbreviate it, that's fine, okay? So what's after that?
You determine it, you call the cops.
Huh?
You determine it, you call the cops.
So, cops,
9/11?
that's the cops.
Yeah.
911 is anybody, it could be fire rescue, could be.
Well, emergency services. No.
So activate 911, right? So 911. So what I always like to do, I tell students to write 911 and circle it. Because are you gonna call 911 right away? You don't know. What do you have at that moment? Is it a reason why to call 911 right away? Maybe yes, maybe no. Okay, but you need to have a good understanding. You might get it here in the dispatch information, in the HOI, and the GAP of the patient. So you might get that information there. So if you don't have it there, you continue. What's the next step? Very important.
C-spine.
Okay, do I suspect C-spine, right? What do you think the answer's gonna be?
No.
It's gonna be no. So you don't have to worry about that, but you need to ask. So what's the next step? Mental status, right?
Respiration or APU?
Apple, right? Apple. So everybody should know what Apple stands for, right? What does A stand for, Bianca?
Alertness?
Okay,
Verbal stimuli.
does that be? Is you alert to?
Pain.
Pain. And you? You. Unresponsive, right? So whatever it is that you figure out that the patient is, instead of writing whatever, let's say it's verbal. Circle the V. Just remember, at the end of the scenario, you need to give a report to ALS, fire rescue, right? So, at least you know by looking there. So, what do we have now?
Airway.
Airway, right? Hey, you have your ABCs in better words, right? A, B, and then airway is whether you're flattening or not, right? So it's up to you how do you want to put it. You can put yes, no, or you can put a check mark for yes, or an X for no, whatever you feel that's gonna, help you understand this a little bit, right? So B, you should write this so you won't forget. RQ, right? What else? Lung sounds, what else?
Accessory muscles?
To SAT, right? And then AM for accessory muscles. And then you can just write your answer right there. You guys got that? Laura, how are you gonna assess the rate, rhythm, and quality?
We're gonna assess their heartbeat.
Rate, rhythm, and quality of breathing.
Oh, the breathing, the breaths per minute,
How?
by counting how many breaths. they
Counting what? How are you gonna count that?
Their pulse.
No, that's the pulse rate.
Oh, their chest
Go
rate.
ahead, Dio.
You,
Say again?
Chest rate.
Chest rides. For how long, Dio?
you can do for 15 seconds and
No.
multiply by 4.
No,
5 to 10.
no, sir.
30 times.
30 seconds. Times
When is the 15 seconds again? You multiply by 4?
for the pulse. Okay, so 30 seconds, right? Let's say they tell you it is 18, regular and shallow, right? Just whatever you want to write, whatever you feel that you can understand, okay? And the lung sounds, let's say they're clear, you write clear, O2 saturation, let's say 96%, accessory muscles, let's say negative, right? Negative on that. So we got the A, B, and then the C's, okay? C's once again, tell me the C's.
Circulation.
RQ, right? BP, capillary fill, and the skin color, temperature, and moisture, right? Skin color, temperature, and moisture. Guys got that? This is what you should be writing within those 60 seconds, right? Now what else? ABC, what comes after that?
Patient assessment.
D, right? And what was it we're looking for in this visit?
AAO times 3.
AO times 3, right? So if I was you, you can put D or whatever. AAO times 3. Tell me about AO times 3.
Alert and oriented, and then
Alert and oriented, what?
they respond
Times?
to 3, which is
3 what?
they have either they know their name, the event that occurred, and the time of day. Is it?
So person, place, and time.
Person, place, and time.
Doesn't necessarily have to be their name. You can ask, who was the president of the United States? Or who was the first president of the United States? Something like that. As long as they can focus a name with something.
If they don't get one of them correct, they're AO times 0,
Let's say he knows his name, right? He knows his name,
Inspection.
doesn't know where he is, but he does know what month it is. So that would make it what?
AO
How many
times
questions did he answer correctly?
1.
No, he answered 2 correctly.
2.
So that's
So AO
AO
times
times 2.
2. Okay. If he has just one of them wrong, that means that he's what? How is his mental status there? What's that called? Altered mental. Okay, he's altered mental. So that right there might be the reason why you're calling 911,
That's
right?
if he answered just one question.
Hmm?
That's if he answered one out of the three.
If he answers one wrong,
Oh, one wrong.
okay, you just need one to make this patient altered mental. You got that?
So if
I've
that,
been in your lab lately. But the thing is, you guys haven't done patient assessment.
Yeah, so I'm gonna get it.
So that's why you probably haven't done it in your lab. But you've done it in lecture, because in lecture it does come up.
so it takes just one out of the three to,
To make the patient altered mental. And that'll be enough reason to, okay, now patient is altered mental, I'm gonna call 911. Let's say you didn't get anything out of this, right? But you got it here. So it's deformity disabilities, right? E. Now what do we have? E, which is what? Exposed, right? You can write exposed, you can write E, whatever. So you should know what to do there, right? So
Cut close.
after you expose, what comes after that? What comes after that?
patient assessment?
Oh,
This is all patient assessment, huh?
The rapid medical.
That is the exposed.
Oh, sample and OPQR.
Sample, right? And you're gonna write sample. And give yourself ample space to write it. Right? And then what else? OPQRST. S, what's that stand for? Bianca,
Signs and symptoms.
signs and symptoms. Okay, this is the quick history of the patient, right? History of what's going on with him at that specific moment, and also his past medical history. That's what you need. Okay, history of the call or history of his chief complaint, right? Or his past medical history. So, S, signs and symptoms. You don't have to write signs and symptoms. So you need to know what sample stands for. Signs and symptoms, right?
Allergic to any medication.
You, sir, ma'am, are you allergic to any medication, right? So allergies, you have to write allergies. Remember, you only have 60 seconds. You're writing sample. Suseg, M,
Medication?
medications. Are there any medications that you take, right? P, Joe,
Past Medicare, past oral intake?
no. Bianca,
Past medical history.
past medical history, okay? You don't have to write the whole word. By now, you need to have known already what sample stands for and what OPQR stands for. L, divine, L,
Last oral intake.
that's oral intake, right? What was the last thing that you ate or drank? Okay, not just ate, drank also, okay? Very important. Now, for test purposes, you are gonna use OPQRST, but OPQRST is mainly used for what?
Pain.
For pain, right? Someone who is complaining of pain. I'm having abdominal pain. I'm having chest pain. I'm having a headache. Headache is pain, right? Or they tell you I'm having pain to my right arm. Whatever it may be, anything has to do with pain, you use OPQRST. Now, for test purposes, you are gonna use it, right? You are gonna use OPQRST. That's why you're gonna write it in your paper in that 60 seconds that you have. So O stands for what?
Onset.
Onset. Onset of what the chief complaint is, when it started. Like how long ago? Like 15 minutes ago, an hour ago, 4 hours ago, 3 hours ago, whatever they tell you, there, onset. P, Diego.
Pain,
No, sir.
Provocation.
Provocation. And you ask them, sir, this pain that you're having, is there anything that you do that makes it better or worse? Okay, let me tell you one. When I start walking, I get more short breath. Or nothing. Nothing that I do makes it better or worse. Okay? So whatever they tell you. Q. Joe, what's your boyfriend's name? Chris. Wait, what's up with that?
What?
What do you mean what?
So what?
I know what I'm talking about. Q, what's that stand for?
quality,
You said it.
Quality.
Quality. Can you describe the quality of your pain? And they might not understand what you mean by that, so give them examples.
1 to
Is
10.
it pressure? Is it crushing? Is it stabbing? Is it numbness? Whatever it may be. R, Chris. That's why you gotta stop sitting back there. You know what I'm gonna do? Where's Beatrice?
They disappeared. Both are girls.
I'll be on.
They said they don't got time for this.
Oh well. I'll sit you in the front too.
I don't know what R stands
Is it
for.
rape?
Huh?
Is it rape?
Joe,
Radiation?
Joe,
Radiate.
radiation, right? Does that pain that you're complaining of go anywhere else besides where you have it? Okay? Usually typical symptoms of chest pain or somebody's having an MI, they'll tell you it's radiating to my left arm. I have chest pain in my jaw or my teeth or in my neck. And if it's an aortic aneurysm, you know, it goes all the way to my back. Now, if it's a female, what happens is one of their signs could be just, I'm having pain in my right arm. So they're teaching that a little more, and I teach it a lot too, because not a lot of people won't tell you that. But a lot of that is going on now. They've noticed a lot of female patients will tell you, I have pain to my right arm.
Is that the same thing as region? That's what my other instructor told us. Region, like where the region where the area is, the pain where it's coming from.
But yeah, but it's mainly where is it radiating to?
Okay.
Okay, that's where I need to know. No. Yeah, I already know you have chest pain, or you're having a headache. But is it going anywhere else besides there? Okay. I know you have that abdominal pain, but is that abdominal pain going to like your back? No. All right. S. Bianca.
Severity.
Severity. From a scale to 1 to 10. 1 being nothing, 10 being the worst pain you've ever had in your life. Explain it to them like that. Worst pain you've ever had in your life. What number would you give this pain that you're complaining of? Whatever they tell you. Oh, it's a 7, 8, 9. That's why you gotta paint the 10 like the worst thing that they've ever had. Got it? Okay. And 1 being 0, nothing. Right? And then T.
Time.
Laura. Time what?
When did it start?
Yeah?
Or how long you've been having it, or when did it start?
No, that will be an onset, right? So time is since the time that you've had it, whatever
Has
pain
it
you're
got better?
complaining
Has it
of,
got better?
has it been, no, not better,
No?
has it been constant,
Or is it?
or does it come and go,
Uh,
okay? Because that can make a difference to try to come up with some type of possible diagnosis, because everything we do in the field is a possible diagnosis, right? So, we got that. So now that we have a history, now that we know they're allergic to any medications, now that they, whatever we found out about them, their chief complaint, all this stuff, what do we do now? You're gonna write treatment. You're not gonna write the whole word treatment, just write TX, okay? TX stands for treatment. Like for history will be HX, okay? Drugs will be RX, right? So you can write that. So TX, treatment. And when you write the treatment, the TX, you're gonna write, so you won't forget, you're gonna write 5 R's, okay? 5 R's.
Hey, Alex. I'm so sorry.
Oh yeah, that's to read the medication, to make sure you give it to the right patient, right date. What else is there? Right date, right medicine, right medication. Oh snap! God dang. So we're gonna be prepared for this shit right here.
Can you understand my handwriting?
Can I? Can you understand my handwriting is the question. This is not even English. Well,
All right.
it's partially because I'm
So 5 R's.
of course.
These are the things that we need to ask when you, before you give them medication. Okay? 5 R's. Okay? One of them is it the right route? Okay, like for example, if it's nitro, what's the right for nitro? Not PO. Sublingual.
Right. Right dose.
Right dose. Okay. yeah, like for example, if you don't remember what the right dose is, it's right there, okay? Right there. Here it says it's 400 micrograms. What is 400 micrograms if you're gonna make it a bigger number? Bigger unit. Huh? 4 milligrams, okay? Cause I was knowing it's 4 milligrams, okay? So, right, route, right, what did you say, man?
Dose.
Right dose, right? Right person, so, because this should be prescribed for the patient itself, right? So, okay, Pepito, okay, it's Pepito. What's the other one? Right date, meaning, is it expired? Okay, you don't want it to be expired. All right, and what's the last one?
That's what I was gonna ask you. What's the last one, sir?
It says it there in the paper. Somebody read it.
Right medication?
We went through that one.
Have right medication, right dose, right patient, right date, and right route.
Okay?
Oh, yeah.
And medication.
Medicine.
Okay, so if he's complaining of chest pain, am I giving him the nitro or am I giving him, let's say, the MDI? Okay, so you have to check the 5 R's. You don't check the 5 R's, critical error. Okay? Yeah. Okay? You guys got that? You're gonna check the 5 R's, critical error. Okay, now that you check the 5 R's, what do you have to do?
Reassess the patient.
Reassess the patient. That's why I always tell everybody, how many assessments are we doing of the vitals? 3. So your primary ABCs is your first one, right? 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 So what I do, I tell you guys write number 2 and number 3. You guys got that? Instead of writing reassessment or ongoing assessment, you already know that this is your reassessment and you know that this is your ongoing, right? So now you know what you're checking, right? You know what you're checking. So you don't have to write again ABC, you already have it already there. Remember, you're trying to save time. You have 60 seconds. So you know you're getting 3 assessments, write your initial ABCs and you write 2 and 3, okay? So now, you already did your treatment, so now you're gonna do your reassessment, right? Because after every treatment of the patient, you need to reassess them. Whenever you do any type of treatment on the patient, you need to reassess, okay? So, what's the reassessment? Airway, how are we gonna ask for the airway? You know, sir, are you feeling any better or worse? If they start talking to you, you know that their airway is patent, so you took care of the A right there. And then the B's, you know that, and then the C's. Now after that, what do we do?
Treat them again?
No. Later on, you're gonna probably treat them a couple of times, or 3 times. No, now we're gonna do what?
Ongoing stuff.
No, you're gonna do your
HOI.
head to toe, right? Your head to toe, your detail head to toe, right? And we're gonna write here, D, F, E, D, L, X.
That's after the second.
You better be.
Sorry.
Amen.
I'm doing good, sir. Thank you.
D,
What? For what?
for DKBTLS.
Oh,
R, deforming. C, she said, divine.
Contusions.
A,
abrasion.
there you go. P, Chris,
Why you always gotta pick me for one I don't want to do?
because I can see it in your face. P, Chris, P, Joe. Go ahead, Gil.
Palpitations.
No.
Punctures, or punctures of penetration. Okay, do one. Punctures of penetration, right? B, somebody said something. Burns, right? T, Juanito. Tenderness. Okay, remember, you're doing that head to toe. That's why all that's there. Any deformities, any contusions, any abrasions, any punctures or penetrations, any burns. That's what you're looking for, right? Physically looking for. Tenderness. Tenderness where?
And the most specific, if it's,
Let's say
quadrants. 4
abdomen, right?
yeah, see,
All 4 quadrants. How about if they tell you my right shoulder hurts?
The left shoulder.
Maybe tenderness in the right shoulder, right?
Over there.
My left leg hurts. Maybe tenderness on the left leg. Patient's complaining of tenderness to his left thigh region. How about that? You understand me? So tenderness can be anywhere, not just the abdomen.
When you're doing the test, you're actually calling all this out, actually doing assessment.
Yes, everything that you're doing, you're saying it, you're speaking. Okay, show and tell, right? L. Suzette, L.
Laceration.
Lacerations. That's what you're looking for. And S, sir. Brothers, what you got in your bomb?
Oh, I don't know, sir, I don't know.
Laura, S. Swelling. Okay, does he have any swelling anywhere? Okay, medical patients, you're looking for swelling or edema in the feet or in the hands. This is a medical patient. You're not gonna have a trauma patient. Okay, if it's a medical call, you're looking for swelling. You know, any swelling in the feet or maybe swelling in the hands. Usually, swelling in the feet or hands means some type of cardiac issue. Okay, he's got that. All right, so we're done with that. What do we do now?
Number 3, reassessment.
The ongoing assessment, right? Which is another assessment. Same thing. Your ABCs. You're gonna start off as, sir, how you feeling? Ma'am, how you feeling? Better or worse? I'm feeling better now.
For the chest. No, you-
And then you start checking your B's and C's, right? Everything that has to go with that. That's right. That's why you're writing your ABCs initially, and you're writing 2 and 3. And then what do we do after that?
That was,
What is it? What's the last thing we did? Huh?
report.
Yeah,
Your report, which consists of what?
HOI,
HOI.
HOI,
findings for A3.
or you can just write history, right? What else?
Findings.
Your
from A3
findings,
From A2.
what else?
Treatment,
The treatment,
assessment,
and then what else?
and then
And then amp, right? So, history, whatever the call is about, whatever the patient is complaining of. Okay, history of the incident.
Amp?
What's that?
We'll get to that now. Let's go on. Jesus Christ. You guys want to jump all the way to the end. All right, history of the incident,
He's about to say.
right? Oh, I'm having shortness of breath. Due to, let's say the patient got stung by, multiple ants or bit by a bunch of ants, whatever it is, right? Findings, right? Here's where you're gonna give your initial vitals. Patient's area was patent, his initial breathing assessment was all that, right? Regular in quality, 18 regular and shallow, clear 96% of O2 sac, and negative in the accessory muscles, right? And then you also give the C's, okay? That's what the findings are, what you found. Okay, also found the patient pale, cool, and diaphoretic, his breathing vitals are this, and his circulation vitals are that, okay? And then treatment. Okay, I put the patient in a Trendelenburg position, I gave him an EpiPen, okay, whatever it is, whatever you did for the patient, okay? Positioning of the patient and the medication you gave him. And then the reassessment, okay? I need to know how he is when you got him, that's why you did this, right? And then I need to know how he is now when you're giving him to me, right? How he is when you got there, and now how he is now. How he was when you got there, and then how he's doing now that you're giving me the patient. You guys got that?
Yes, sir.
So, Laura, you're going all crazy. Wasn't it you about the amp?
No.
Oh, okay. So amp, what do we have here? What's this called?
Sample.
So what I need to know is this. I need to know that, okay? Because you're giving me a history of the incident and findings, you're already giving me the S, the sample, right? So I need to know this. Patient is allergic to morphine, patient takes Xanax, Tenorol, and Ativan.
I'm sorry, my mind was somewhere else. Can you say that again?
The bind.
The amp?
AMP is
Wait,
sample,
A and
that's
P or
sample
something.
A and B.
The amp of your report that you're gonna give is the A of the allergic to any medications, M, the medications that they take, and P is past medical history.
I got
Is
you.
that important to me? Yes, I need to know, is he allergic to any medications? How about if this patient goes unresponsive while I'm transporting him? And he was allergic to, let's say, there's a medication called furosemide, and the patient had fluid in the lungs. One of the medications that we give for fluid in the lungs, or what's another word for fluid in the lungs, Bianca? Suzette? Joe? Reals? Chrissy? Okay, Rail, what's another word, Chris?
No reason.
Crackles.
Crackles, okay. All this stuff is the same thing.
When I know.
So, one of the medications we give is, it's called furosemide sulfate, okay? So, they tell you, oh, I'm allergic to furosemide. But you didn't ask them, I got the patient now, patients are responsive, I assess the airway, I assess their lung sounds, he's got fluid in the lungs. What do you think is one of the medications I'm gonna give him? I'm gonna give him furosemide, which is also called Lasix, Lasix, okay, Lasix, same thing. Okay, now I give it to them, I didn't know they were allergic to that medication, now I'm making this patient worse. So that's why it's important for you to ask that, right? And then P, past medical history. He's having an MI now, okay? I'm confirming he has an MI. Now he had told you when you were asking him his history, oh, I had an MI 4 weeks ago. 4 weeks ago, 4 months ago, 4 years ago. All that is very important to me, and it's also very important to the receiving hospital. Because if you tell me, Suzette tells me, this patient said that, 6 months ago he had an MI, and I start doing an EKG, there's something in an EKG that's called a pathological Q rate, okay? Everybody pretty much has seen how pretty much a pulse is, right?
Mm-hmm.
Right? Like that? Okay, there's something called a pathological Q rate. When somebody had an MI, it looks like this. Okay? It's different, right? It's a lot different. So if I see that, okay, and somebody who's complaining of chest pain, and I'm seeing his MI, and I see this, and I don't know that that patient had an MI 6 months ago, I'm assuming that this means the tissue is dead. The tissue in that specific area of the heart is dead. So if I see that, I'm like, wow, this guy had a massive MI. So I'm assuming he's having something big going on. But you guys gave me good information. I know that this is there. Once a person has an MI, an old MI, and the death of the tissue occurred, he's gonna permanently have this. Permanent, all the time. Okay, and if he has that, I see that, and you guys told me, he had MI 6 months ago, then I know why that's there. You understand me? Right, so very important. So that's it, that's basically it.
You said the PQRS is always going to be down if they have a.
This is called, don't worry about this right now. I'm just trying to explain to you why it is so important for you to tell me their history. It's called a pathological Q rate. Okay? Pathological Q rate. Right? Don't worry about that too much right now. It's gonna take at least 2 or 3 semesters for you to get to that. But I'm just giving you an example so you have an understanding why.
The E in the first assessment is the rapid head to toe, right?
Expose, right? You're exposing the patient. So that's your rapid. That's why you're writing E, or you're gonna write expose. Okay? That's pretty much it. I mean, you think you guys can write this in 60 seconds?
Yeah.
Of course. Just gotta practice. Okay? You gotta practice. And instead of writing assessment, reassessment, ongoing assessment, you're saving time by putting 2 or 3. Believe it or not, writing a whole word can take you 5 to 6 seconds. So you're saving time. Right, Dio, you okay? You look like you're about to burst.
I am about to have an MI myself.
Don't say it.
Oh, I
Don't say
can't
it.
give you any nitro or aspirin. All this is expired. You're just gonna end up croaking. All right. So, any questions when it comes to this?
Just time to practice.
Joe.
Just practice.
Chrissy. Chrissy.
That's Christy. That's not me.
That's you. That's Chrissy.
That's the other guy.
So, you know what?
Practice. That's it. Just need to practice.
Basically it. I wanted to get this down packed for you today because believe it or not, this is very important. Very important for you to start getting an understanding of all this. Once you get an understanding of this, then everything else will just start falling in place. Okay, once they start giving you scenarios, on Tuesday, you'll start getting, you know, a good idea. But like I said, it's not gonna be trauma related at all. It's gonna be those 5 scenarios. And it's gonna be to the point. Later on, when you guys are in P1, P2, and P3, it can be a mixture of things. The patient could be involved in an MVA. They'll tell you, okay, patient had a motor vehicle accident, car versus wall. Right, you go there, what do you think one of the first things you gotta check? Patient responsive, am I suspecting C-spine, you know what I mean? So it's a mixture of things. And you see a patient who crashed against the wall, yes, you are going to assume they have C-spine. Now the patient's unresponsive. So, okay, why is he unresponsive? Did he have a head trauma? Did he get shot? What's going on? And what's the first thing I told you guys that you should check on an unresponsive patient? Pupils.
Breathing?
Carotid pulse?
Say again?
ABC?
No,
No. You have an unresponsive patient. This is one of the first things that you should check that's gonna like
Glucose levels.
the glucose levels, okay? So there's scenarios like that that they can give you. You check the glucose and the glucose says it's 40. Oh, okay. So now you know why this patient's unresponsive.
Normal is 80 to 120.
Okay, yeah. You understand? But that's later on. We're not gonna mix it all up.
please.
It's gonna be straightforward. It's
I'm
gonna be
already mixed
straightforward.
as is already.
He's having shortness of breath, he's having chest pain, he's altered mental. Let's say in the history of the incident, you get the information to tell you, patient's wife says that the husband is acting weird. Okay, and you start talking to the patient, and the general appearance of the patient, the instructor tells you, no, the patient is just mumbling, or when he speaks, he's speaking slurred speech. You know what I mean? What would that tell you? Is he altered mental or not? Yeah. Okay, so that's the reason why to call 911. But then later on, let's say here you do all this, okay? Off the bat, if they tell you, if you know he's altered mental, that's a reason why to call 911.
That was gonna be my
But you
next.
still don't know, why is he altered mental? When do you think you might get it? You might get it here. The wife tells you, well, you know, he has a history of diabetes. Oh, okay. Right, so now you know what's going on. So you finish the sample, put his open here and see. Now you're gonna treat the patient after asking the 5 R's. Then you know this patient is altered mental status. He has a history of diabetes. Most likely he is hypoglycemic. You guys got that? Okay, so it's gonna be straightforward. There's not gonna be any, you know, goofing around and making you guys confused or giving you this, then it becomes that. It's gonna be to the point.
Can you demonstrate the hands-on?
Yeah, the head to toe, like a rapid one. Just that, and then we'll get home.
It's rapid, it's quick.
Yeah,
Real quick,
full
Alex.
detail one.
When will be, when is like super solid that you have absolutely no doubt to call 911? That's honestly
All right,
like one of my.
once again, when is the last time Laura could call 911?
Before E, after E, well, when you reach E.
The ending of E,
The
right?
A and E, the A through E.
Meaning when you check what on the patient?
When you're gonna do
The exposed checking of the
When
patient?
you check what? Chris, when you check what on the patient?
To call 911.
What's the last thing you check physically on the patient, Suzette? Say again? The back.
Oh.
The whole back of the patient, not just his back or her back, the whole back of the patient, right? So after you did that, or you do that, that's it. That's the last time or last chance you have to call 911. If you keep on proceeding, they're not gonna tell you, hey, did you forget something? They're like, oh, okay,
So
good,
you
good
are
job, good job,
calling
good job,
911.
Suzette, good job. Good job, Joe, or, what's his name, Jason? Lewis, same thing.
We are calling 911, so we just don't know yet if it
You
is.
should know why, because I'm gonna ask you, okay, why are you calling 911?
He's having a shortness.
You can't say, oh, just because I want to, no.
Exactly, that's my question, they're like, when.
But
will
by then, you're gonna have enough information why. He's like,
But is it, right after we
just
do
call
the
911.
gap, shouldn't we know whether we're gonna call 911 or not?
You should, but maybe the patient's talking to you and tells you, I'm just feeling dizzy. Is that a reason why to call 911?
No.
Okay.
And that you're figuring that out right there, that was your gap, your gap, like you're still not sure if you're gonna call 911, yes or no. Like
Right. You should have enough information between the dispatch information, the HOI, and the GAP. You should. Like, if they tell you off the bat, I'm having chest pain, call 911. He tells you I'm having shortness of breath, call 911. When you're getting the general appearance of the patient, they tell you the patient's acting weird and he's mumbling. He's altered mental, call 911. The patient's unresponsive when you get there on scene, call 911. You guys got that?
Yes, sir.
It's to the point, right? All right, let's do a detailed head to toe. All right. First thing you do is you're gonna check. Remember, you're gonna have gloves on. You're gonna say, I'm gonna start in the head. Do I see anything or do I feel anything? Okay. Do I see anything? Do I feel anything? They ask you, okay, what do you mean see anything? I don't see anything like blood or any deformities. What do you mean feel anything? Anything like crepitus, right? What's crepitus? Joe, what's crepitus?
Contusion?
Not contusion.
Deformity in
Laura.
the head.
Crepitus. Suzette.
Like a tendon.
No, no.
Nah, it's like grinding bones or like broken bones.
Grinding bones due to some break in the bones, right? That's what crepitus would be. So all you need to say is, do I see anything, feel anything? Remember, you have a certain amount of time to complete it. So I know what you're saying. Every instructor knows that what you're saying. You tell them, do I see anything? Do I feel anything? Okay. So I'm gonna check the head. Do I see anything, feel anything? I'm gonna check the forehead for any deformities. Check the eye for what, John? For pearl, right? What does pearl stand for, sir?
I know it.
Yeah.
Pupils reactive to light.
Pupils.
Pupil equal reactive to light.
Okay, good. Pupils equal and reactive to light, right? One eye, you gotta cover one eye, flash them for say for a couple seconds. You wanna see that pupil constrict. And that's why you're staying there for 2 or 3 seconds, because it might take them a little longer. If it's really slow, that means that their pupils are sluggish.
You said
So-
constrict?
Constrict.
Yeah, constrict.
It's one.
Man, I'm tripping.
They go like that.
I thought,
Have you done it to yourself?
no, I thought on the test it said dilate.
A personal question.
No, I'm saying like putting the light pen to your eye yourself and see it constrict by yourself.
Oh, I thought that you're asking something else.
No, okay, it's constrict.
Carry
I know
on.
why I thought dilate.
No. The light is gonna make it because it wants to reduce the light that's coming inside the eye. So, put the light, then the other side, checking the eye for pearl. Once you did that, bottom of the eye, checking for raccoon eyes. Okay? Then you're gonna check the ears, nose, and mouth for fluid or blood. Check the back of the ear for battle signs. Okay? All these raccoon eyes or battle signs are basically what it is like bruising or black and blues. That means that the patient has some type of a broken bone somewhere in his head. That's what causes that discoloration. So ears, nose, and mouth for fluid or blood. Back of the ear for battle signs. Check the mouth for deformities. Neck for JVD, tracheal deviation. Shoulders, you're gonna push down shoulders. And clavicles, you're gonna ask, are they intact? I'm gonna check for equal chest rise. I'm gonna check the torso for any crepitus. Abdomen, all 4 quadrants, soft and untender, because that's how it should be, soft and untender. I'm gonna check the groin area for incontinence or priapism. Pelvic area, down and in. Is it stable? They're gonna tell you yes. Remember, this patient does not have any trauma going on. Okay, I'm gonna check the right femur, and I want you to use what this is. You're checking the right femur. Right to fib. You're gonna say, do I see anything, feel anything? They ask you again, what do you mean, see anything, feel anything? Same thing as before. Any blood, or do I feel any crepitus? Okay. Left femur, do I see anything, feel anything? Left to fib. You see why I'm doing like this? It's called a contralateral movement. Okay. The reason why you're doing this is because if there is a fracture and you're moving contrary from each other, it's gonna move. Okay. A lot of people, you're gonna see when you're practicing, a lot of people go like this. There's no way in the world you're gonna feel if there's a broken or fractured bone by going like this. Of course, you're not gonna crank it down like that. Just, this is enough. That's more than enough. And then once you guys are done with that, move over here. You're gonna say, I'm gonna check for PMS. Pulse, motor, serve, push down, sensory. Do you feel this? Then you're gonna go to the upper extremities. Right humerus, right radius ulna, Do I see anything, feel anything? Left humerus, left radius ulna. Once again, do I see anything, feel anything? And then you're gonna get both hands. I'm gonna check for pulse, motor, squeeze my hands, and sensory on the forearms. Feel this. Okay, whatever they tell you, you write it down. And then you're gonna put the patient towards you. Don't do this. People do this. What do you think is gonna happen?
Fall over.
Patient's
Fall
gonna
on his
fall.
head.
And I'm telling you, the dummy will fall. Because it happens all the time. I see it all the time. I'm like, Jesus. All right, so you do that. Patient towards you. All right? Shoulder and hip. Check the whole back of the patient. Okay? And this is where I'm gonna answer one of your questions. How about now, the patient saying I'm having shortness of breath. All his vitals kind of seem okay still. Okay, maybe he's only setting 96, his O2 set is going down. You go like this and say, well, he's got urticaria on his back. Okay, so when did you find it? At the end of E, right? When you check the back.
Mm.
And that's really the last time you have to check. Call 911.
And
Guys
then
got that?
when you find the urticaria,
You call 911. Okay? All right, you good?
Yes,
It's
sir.
like a cardio section, man. I'm sweating.
I'm gonna have to have an intubation kit there ready for him, just in case he goes unresponsive. All right, you guys are good?
Yes, sir.
All right.
Thank you, sir.
I think
Thank you,
this
sir.
should be more than enough for today. Honestly,